The diabetes drug Ozempic might be able to do what no other drug in history has ever done. I'm not talking about weight loss or heart disease. It might finally break up the Big Pharma cabal that controls drug prices. Because Ozempic costs, what, $1,000 or more in the United States? In Germany, $140. In the UK, $92 a month. And in the United States, $1,000. The same drug. Of course, the story is repeated over and over and over and over again. Ozempic, though, is different because what it can do for an entire population. Here's Vermont Senator Bernie Sanders.
It is not just an issue of corporate greed. It is a profound moral issue. Novo Nordisk has developed game-changing drugs which, if made affordable, can save the lives of tens of thousands of Americans every year and significantly improve the quality of life of millions more.
All right. Chief Medical Board member Dr. Drew Pinsky is here. It's political season, so we sort of think about it in that sense. If there was only a politician who got up, their only platform was free Ozempic for everybody, I think they'd get, what, like 80% of the vote?
I think you're onto something here. It's chicken in every pot. It's the modern equivalent of that. But, I have so many mixed feelings about this story. I have to tell you, the overprescribing of Ozempic is something of grave concern to me. I have seen some profoundly serious side effects in situations where it wasn't clear to me the benefit that the patient was getting. Now, when it's properly selected patient group, when they are obese, they've tried everything else, their blood sugar's out of control, they may have had a major complication like heart disease, yes, absolutely the risk is worse there. But for somebody who wants to lose some weight for a wedding, that is only going to end up in very seriously negative outcomes. You only put yourself at risk. To just focus on the price issue with this drug throws the whole thing into so much about our healthcare system. Why should it be tens of thousands or hundreds of thousands of dollars more to get a plastic surgery procedure here than Mexico or Brazil? Or why should someone using the free market, what the market will bear, which is what Ozempic is doing, be allowed to charge per unit time as a physician 1,000 times more than I get from a Medicare reimbursement? That's what the market bears. Now, I do agree that this is such a large-scale issue that could have such profound impact that the corporate greed may certainly find, let's say, people that are receptive to this story, because it is a story of corporate greed. But let's remind ourselves, again, in terms of cost and demand, in Denmark, this is a Danish company, my understanding. Denmark, they don't allow this drug. They don't recommend it. And here, people are getting it online. It's everywhere.
Right. Now, here there's ads online for it. Yeah. Okay. No, I understand. Look, Novo Nordisk's stock's gone up 520% in the last 10 years. Pretty good. And this always comes back to this issue, right? When we talk about it with all sorts of different drugs over and over and over again, the same story about is it the drug companies, or is it the drug companies in cahoots with the insurance companies? To be fair, here's the CEO's response to Senator Sanders.
We don't decide the price for patients. That's set by the insurance companies. I do acknowledge that there are patients who have poor insurance or no insurance. And if you, in the US, do not have insurance, if you have a low income, we actually have support programs to help those patients.
So there's a flip side. Go ahead.
Well, I was going to say, and how insurance is priced and what they're actually reimbursing is so obscure and such an alchemy that nobody can understand it. And sometimes I think it's intentionally obfuscated.
Oh, well, of course it's intentionally obfuscated. If everybody knew how much these guys were making, then there'd be riots in the streets. How much obesity will cost in America? The U.S. spends $147 billion annually on obesity-related health care. I would argue that number is probably low. I understand there's a lot of risks, but at some point, if Ozempic and Wegovy and Mounjaro, all these drugs, are as effective as it appears they are at treating obesity, new data out today, severe obesity is on the rise, that at some point it's cheaper, as I started the segment by doing, to just give everybody free Ozempic.
Possibly. I mean, I get the argument you're making because of the burden of disease associated with being severely overweight. But again, I'm so concerned about overprescribing of this drug. It is a very, very useful tool. It is going to save lots of lives and help lots of people in a multiplicity of ways. But much like other popular obesity treatments over the years, like things like fen-phen, where I remember clinics being set up everywhere. People were going to have to stay on this medicine the rest of their life. It was going to save millions of dollars. You know, it's the same argument. And all of a sudden, where has that gone? And it wasn't that many people that were harmed by it, and people abandoned ship completely. So one of my fears is, frankly, when you go too far to one side of the ship, just like we're doing with opiates now, we are disgustingly overprescribing opiates. Now you can't get pain medication for patients that need it. So this back and forth is more of the excesses of bureaucracy and less about the practice of medicine. And I'm just gravely concerned about these centralized authorities determining what doctors can do and determining price, everything about the centralization, everything about the insurance is controlling things. This is the central problem in our healthcare system.
No, I don't want to get political, but there is one presidential candidate who said they wanted to eliminate private insurance and have the government control everything. So your point is well made.
That's going all the way into trouble. That's jumping all the way into the centralized authority. And patients do not appreciate how bad that will be for them. They just don't get it. It's going to be it would not be what you imagine.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.